Hey guys, hope you're doing well. This is going to be my video on pneumonia featuring my mama llama. To start out, pneumonia is a lower respiratory infection that causes inflammation and consolidation in the alveoli. It's usually caused by post-surgical immobilization, COPD, heart failure, and other risk factors such as immunocompromised individuals and impaired cough reflex. There's two main types of pneumonia, bacterial and viral. During this exam, we'll be looking more into the bacterial, marked by nausea, vomiting, malaise, and pain, and it can be treated by antibiotics, whereas viral has upper respiratory infection symptoms, cough, low-grade fever, and complications such as pneumothorax and respiratory failure. This slide shows an example of a patient history taken with symptoms including shortness of breath, productive cough, fatigue, and malaise. A past or current diagnosis of COPD and acute bacterial pneumonia due to immobilization, which they're taking beclomethasone and penicillin for. And also no history of surgeries, but a family history where the brother had COPD for 2 years and received pulmonary therapy and quit smoking, which helped.
Hi, my name is Talia. I'm going to be your student physical therapist for today. Can I start by confirming your name and date of birth?
Yeah, my name is TBrenan and date of birth March 4th, 1961.
We'll be doing a pulmonary or a lung exam today.
Okay.
So I'll just need to feel a couple different things on your chest. I'll be listening for different lung sounds with my stethoscope and a few other tests that I'll explain as I go.
Okay.
At a certain point, I will need you to take off your shirt. However, I do have a robe that you can wear on top. Is that okay with you?
Yeah, absolutely fine.
Okay, great. So let's get started.
Okay.
Because I don't have a pulse ox, I'll be starting by taking blood pressure. I have to feel for the brachial pulse, and then I will place my stethoscope.
And I'll just need a little bit of quiet during this, okay? First thing I'll have you do is just go ahead and hold your hands out in front of you. Okay, and flip them over for me. Great. Now I'm going to run my hands along to test your temperature. Put the nails of your index fingers together just like this. The next thing I'm going to be doing is taking your pulse right on your arm right here, and you can just relax for me, okay?
So before we get further into the exam, we want to examine the patient head to toe, including any areas that we can see, like the head, neck, skin, and hands.
I need to do a couple more tests to examine the chest wall. So I'll have you take off your shirt. You can leave your bra on, and then I'll ask you to change into the robe. Okay, so the first thing I'll be assessing is your trachea. Okay. So I'm going to feel right here. Just let me know if it's too uncomfortable, okay?
All right.
The next thing I'll be doing is assessing your chest wall, so I'll just need you to lower the gown a little bit so that I can see this area right here.
Okay.
Do you have any pain in your arms?
No.
Okay, great. So I'll have you lift up your right arm, all right, and relax, and the left. The next thing I'll be doing is called tactile fremitus. So what that means is I'll be placing my middle finger in between your ribs, and I'll just be tapping to hear if there's any abnormal sounds.
We'll start right here.
And I'll have you lift up your breast tissue for me.
Is that good?
Perfect.
And same on the other side. Alright, and same on the other side.
Okay, so the next thing that I'm going to be doing is using my stethoscope to hear if there's any abnormal lung sounds, okay?
Okay.
I'll have you take a deep breath in through your mouth and then out, okay?
Yes.
Alright, keep breath in. And out. Good. In. And out. 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 And take a breath in. And out. And on the side. In. Then out.
And now the sides.
In. Then out. In. Then out. Great.
Now I'll ask you to say 99, and I'll be feeling with my hand in those same areas.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So the next thing that I'll be doing is I'll ask you to say the word 99 while I place the stethoscope on each of those sections.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, so the next thing that I'll be doing is called chest expansion. I'll place my thumbs along your ribs, so the only area that I really need to see is this area right here under your bra, okay?
Okay.
So if you could uncover that for me. Alright, and I'll have you breathe in and out. And breathe in and out. So now I'll be assessing your chest expansion. So I'll feel for both sides of your ribs here. And now I want you to take a nice deep breath in and out. And one more in and out. Great. Next thing that I'll be doing is I'll be listening with my stethoscope. I'll have you cross your arms, and each time I place it down, I'll have you take a breath. I'll have you say 99 with the palm of my hand, okay?
Yes.
99, 99, 99, 99, 99, 99, 99, 99,
Okay, now each time I place it, please say the word 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So essentially I'm going to do the same as what I did on the front. Place my middle finger and tap. Now each time I place my stethoscope, I'll have you whisper 1, 2, 3. Okay, and now each time I place it, I'd like you to say the letter E. Okay, so I'm going to do the same tapping as earlier. This time I'll have you breathe in and hold that breath as I go down, and I'll have you cross your arm. So a nice deep breath in.
And hold that breath out. Hold that breath. Okay.
The same on the right, so go ahead and take that breath in for me.
Okay, so right
There. And let that breath out for me. Okay, so now what I'm going to do is I will be placing this tape measure around you, and I'll be measuring the depth of your breath. For this, I'll need you to remove the robe so that I can place this around.
All right.
Okay, so go ahead and take a nice deep breath in for me. And out. Okay. Okay, take a nice deep breath in for me. And out. Great. The last thing I'll have you do is produce a cough for me. Okay, that's all I needed. Thank you.
So in addition to the exam, a few tests and measures that may be beneficial include radiography or CT to get a better understanding of what the pneumonia looks like on imaging. Vitals to establish a resting baseline. So during this exam we did blood pressure, heart rate, and respiratory rate. However, pulse oximetry is also a very important vital that should be taken. A sputum culture if they have a productive cough, spirometry to help us gauge the patient's lung capacity and fatigue, and lastly RPE in addition to those vitals. So that's the end of this video. Since I didn't have any bloopers, I included this short cartoon. I hope you all have a great rest of your week.